Ankle arthritis is one of the common problem we see in our orthopedic practice, and prevalence worldwide is nearly 1% of population, and 10 to 13% of people aged more than 50 years do suffer from ankle arthritis. It's a quite debilitating condition with a lot of pain, restricting their daily activities of living, and we needs to be addressed. Ankle fusion, also known as ankle arthrodesis, is no longer accepted as the gold standard procedure for addressing this problem, because this leads to a lot of morbidity, restricting the movement and also affecting the quality of life. And also this leads to development of arthritis of the adjacent joints of the foot. Hence, the ankle replacement came into existence. Earlier results of this total ankle replacement surgeries were highly disappointing, owing to the high complication rates and failure rates. However, with the development of newer designs and improved surgical technique and expertise training, the present day outcomes are very much satisfactory. This total ankle replacement surgery is a quite common known entity in US as well as European country. However, very rarely these kind of surgeries are performed in India. From last 2 years, it has gained momentum in our country. With this background, I'm going to share the success story of the total ankle replacement surgery performed first of its kind in Bengaluru at Narayana Health. It was a 64-year lady who came with pain in her left ankle, suffering from quite a long years, and she had an injury in the past, quite a long back, for which she underwent surgery, and later on some metal work was done which were again removed. But however, day by day the problem got aggravated and she was suffering a lot, which affected her daily activities of living as well. And when I examined her, she hardly had no movements at all in her ankle. You can see in the picture, no movement happening at the ankle joint. The ankle joint was totally stiff, and that's how she walks. She was walking before the surgery with quite a lot of pain and limping. And we do scoring system based on AOFS, that is American Orthopaedic Foot and Ankle Society scoring, where 100 is considered as normal based on the pain level and the activity level, and it was 32 out of 100. And this is the X-ray. We take a weight-bearing standing X-rays of the ankle. You can see the bone end-on-end configuration of the two bones in the ankle joint. I had a lot of discussion with her, explained about the pros and cons of surgeries, and ultimately she agreed because she wanted some movement in the ankle joint. And we always use image intensifier, that's also called a SIAM machine, inside the operation theatre, where we can exactly access the surgical techniques. And this is how it looks just before taking the cut in the bone. So that you can see the picture, that's the SIAM machine standing in front of me, and that the SIAM picture is seen on the monitor. And that's after preparing. It involves almost nearly about 1 hour procedure. And that's how after preparing, we do a trial reduction with a trial implant and check whether it is okay for our fitting well. And these are the real implants. These are made up of titanium, cobalt, chromium metal, which has got porous surface on the underneath and the shining surface on the top. So it's a 3-component implant where there are 2 metals, one fit into the leg bone and one fit into the foot bone, and in between we keep a poly insert. And this is how it looks at the end of the surgery after replacing the ankle with the implant. So this is how the X-ray looks, and this is the real X-ray. The previous one was the SIAM image, and this is the outcome you can see. So that is the 6 weeks, that is 1.5 months immediately after surgery, and the previous one is before surgery. You can see the difference, and also you can see the scar mark on her left ankle, which has healed well. And she is quite comfortably walking at 6 weeks post-op. And this is at 3 months post-op. We again have a review and take X-rays and also assess the gait. And that's, you can see the improvement at 3 months of post-operative period, even more comfortably walking. The replacement surgery, though it is rare in India, but nowadays it has gained a momentum, and A lot of people are coming to get aware about this. But however, in Bengaluru, this kind of implant was performed first time at Narayana Health City, where we successfully conducted the surgery, and also the patient outcome has gone really well. So the indications are end-stage ankle arthritis, where there are no other options left apart from surgery. We offer this kind of procedure for the patients. The most common cause of ankle arthritis is post-trauma. About 78% patients will have some history of trauma in the past, which leads to arthritis. The other less common are inflammatory conditions like rheumatoid arthritis, gout, hemophilia, SLE, other things. And even sometimes where the patient has already undergone a fusion in the past, who wants to recover, regain the movement, we can do an ankle replacement surgery to get back the movement. With this, I thank once again all of you.
Suddenly my daughter's friend, she told me, "Auntie, you come to Bangalore and there is one doctor with us working, and you try with him. See what he says and you try." So my husband and I came and I showed Dr. Shekar my leg and everything. As you see my leg, how bad it was. And he told me, "Don't worry. Are you scared?" I said, "No, doctor, I'm not scared." Because my leg was broken for more than 25 years. And I have taken that pain. So I said, "I'm not scared, doctor." And he said, "Okay, we will do it." I said, "Okay." So we started, and whatever was we started our mission, and our mission got accomplished. And it was a good day, because I think that day was Dr. Shekar's birthday. Yes, I remember that. So I think I was the best gift for him, for my leg. So I would like this thing, if you all can get it to more people, because people are getting scared. But now even we used to get scared, but I don't think you should get scared about this, because everything is taken care of. The hospital was very good. The people were very homely. Everything from the down to the top, they all were wonderful, all of them. And I would only say this, that please, if you all can get this more and more to people, be a very nice thing.
Yeah. Hi, I am here to share the successful story of me performing a total ankle replacement surgery, first of its kind in Bengaluru at Narayana Health Care. And she is Mrs. Jacinta, a 64-year-old lady who presented with a lot of pain in her ankle, and when I examined her, the ankle was completely freezed. She had a history in the past, because of which she developed end-stage ankle arthritis, and there was absolutely no movement at all, and she had a lot of difficulties in performing her day-to-day activities. And the X-ray was also looking very bad, and that's how, after my clinical assessment and examination, I offered a surgery called total ankle replacement surgery, wherein we can regain the ankle movement and also get away the pain. And I explained her about the procedure. However, before coming to me, she had consulted so many surgeons at her place, and everyone has suggested ankle fusion or ankle orthopaedics, where we fuse the joint, and after that they don't have any movement at all, and still they have some morbidity. So this is quite different from the regular ankle fusion techniques we perform for the ankle arthritis. So after discussing, I'm taking the consent and went ahead. And however, there was a challenge wherein we need to get the implant, because the ankle replacement implant is readily not available in our country. So there was another challenge where I had to write to the company from US and Netherlands where they manufacture, and had to take a permission from the Drug Control Authority of India to get it imported to our place. And finally it came. So it, a lot of paperwork. It took around 3 weeks time. And we got the implant, and we planned the surgery on a particular day and performed the surgery. And immediately after surgery, she was put on plaster for 15 days, and later on we removed and we mobilized the ankle and allowed her to take weight. And after 6 weeks, she was completely pain-free, and she was walking without any support at all. At 3 months, absolutely no pain, and she was still more comfortable. And present situation, you can see her now, and you can hear from her as directly.
But
how is it for the first time you performed this surgery? So how do you feel like performing? For the
No,
first
no.
time?
This is I'm not perform. I see. In India, I performed for the first time, but I am used to this surgery in England, where I was undergoing training in Scotland. So I have done quite a lot of ankle replacement surgery. But however, this is first in India. After me coming back to India, like I have performed this one. So definitely, I was not like nervous or anything. It's not a first for me.
So, ma'am, you can share your experience. Okay. So start, madam.
Start. I'm Mrs. Jacinta Agnes Mascarenas. I'm from Goa. This is a very long story, of course. I was going through a very bad phase of pain, and I went to many doctors, and many. All were telling me fusion, but fusion. Then one of my orthopedic doctor who did my knee. I have done a knee replacement also. So he showed me how will I walk after getting infusion. So I said, I don't want this way walk. I want how I walk, the natural way. Then he was trying. Then no. Then as I told you all, my daughter, her friend and my niece, they all got together, and they somehow they told me, Mama, you just come here. You just see. You meet doctor and you see, and if you like it, you will go ahead. There is no problem. So much pain you have already taken. Why you want to go for a fusion? Because I was ready to go for a fusion because my leg was paining too much. I just couldn't bear it. And then I came and met Dr. Shekar. He removed, he seen my leg, and he immediately told me, oh, it's very bad. And then he took the x-rays and everything, and he said, will you do the ankle replacement? I said, yeah. You know that I have not done in India, but I am a doctor who has done there. I said, doctor, there's no problem. I have faith in you, and I know you will do it, because in India nobody does this. And so it happened. Today I am here with you all. I couldn't walk, I couldn't climb a staircase, nothing. But now, in another 6 months, 6 months, I am doing everything. Everything, absolutely everything. Running, dining, walking, talking, everything. So I would thank Narayana and those three little who brought me to Dr. Shekar, and of course Dr. Shekar also. And the hospital took very good care of me, and the whole hospital, everybody, the whole team, they were all with me. They helped me for everything, for the part, everything they helped me. So I had no problem with anything, and I say thank you very much.
Thank you.